transmission are occurring in our north. I want to thank our local public health agencies for their continued commitment to protecting the health and well-being of their populations and for implementing additional public health and workplace safety measures as needed in response to any rise in cases. On a positive note, Ontario still has one of the lowest weekly case rates in the country, and our hospitalization and ICU occupancy remain stable. And our vaccination rollout continues to be steady and strong. Sur une note positive, l'Ontario a encore l'un des taux de cas hebdomadaires les plus bas au pays et le nombre de patients hospitalisés et aux soins intensifs demeure stable. Et notre campagne de vaccination continue d'une manière régulière et forte. We have officially hit our 90% first dose milestone for those 12 years of age and over, and 87.2% have received their second dose. And within the first 4 days of our campaign launch for those between 5 and 11 years of age, we achieved 6.4% of the population, and today we've already reached 12.3%. I want to take this opportunity to reaffirm that the recommended interval between the vaccine doses for the 5 to 11 year age group is 8 weeks for optimal, long-lasting protection. So please keep that in mind when you're booking your child's second dose appointment. I want to say a big thank you to all those kids out there who got their first shot and who have an appointment to get their second. It has been heartwarming to see the images of our young children rolling up their sleeves and doing their part to bring an end to this pandemic. As we continue our vaccine rollout of first and second doses, I am pleased also to announce that we are expanding our COVID-19 vaccine booster dose eligibility. Beginning Monday, December 13th, individuals aged 50 and over will be eligible to schedule their booster dose appointment. In addition, effectively immediately, individuals receiving dialysis are eligible for a third dose of the COVID-19 vaccine. Alors que nous continuons notre campagne de vaccination pour les premières et deuxièmes doses, je suis heureux d'annoncer que nous étendons l'admissibilité de la troisième dose du vaccin contre la COVID-19 dès le lundi 13 décembre. Les individus âgés de 50 ans et plus seront admissibles à prendre un rendez-vous pour recevoir leur troisième dose. De plus, en vigueur immédiatement, les individus qui reçoivent un traitement de dialyse sont admissibles à une troisième dose de vaccin anti-COVID. Beginning in January, Ontario will further expand eligibility for booster doses based on age and risk with an interval of 6 to 8 months from the second dose. We are also recommending revaccination with a COVID-19 vaccine series post-transplantation for individuals who receive hematopoietic stem cell transplants, hematopoietic cell transplants, and recipients of CAR T cell therapy due to loss of immunity following therapy or transplant. Optimum timing for eligible re-immunization should be determined on a case-by-case basis in consultation with their clinical team. In regards to the Johnson & Johnson vaccine, the province is also making a single-dose J&J viral vector COVID-19 vaccine available to individuals age 18 and over who have not yet been vaccinated or for those who have an allergy or contraindication to the mRNA vaccine. La province rend également le vaccin contre la COVID-19 à une dose de Johnson & Johnson disponible aux individus âgés de 18 ans et plus qui n'ont pas encore été vaccinés ou pour ceux qui ont une allergie ou une contre-indication au vaccin à ARNM. Individuals may request this vaccine by contacting their public health unit. For Omicron, finally, I know many of you have been following the news regarding the recently identified Omicron variant. There are 5 cases of this variant confirmed in Ontario, and additional cases will be likely identified in the near future. There continues to be evolving information on the variant's transmissibility, its severity, and its impact on the vaccine effectiveness, and we continue to closely monitor the situation globally and in Ontario. We are fully prepared to adjust our testing, our case and contact management, our vaccinations, our hospital capacity, and public health measures as needed to respond to any new threat. I also want to remind Ontarians that if you have returned from any of the 10 countries identified by the federal government as a country of concern, you are required to get a COVID test following the guidance and remain in quarantine for the remainder of the 14 days from the date of your entry into Canada, even if your test result is negative. Remember that when you're in quarantine, you should not be leaving your place of isolation and should avoid contact with those who did not travel with you. We also ask that you advise all your close contacts that they should be tested for COVID-19. The Omicron variant reminds us that the COVID-19 pandemic is far from over. We must remain cautious and humble in the face of this virus. But I do want us all to remain calm, to follow the science, follow best evidence, and we will continue to follow the epidemiology. We have a tough winter ahead of us, but by going back to the basics that have done us so well over the last 20 months, continue to wear your masks, wash your hands, practice physical distancing, stay home when you're sick, get tested if you have symptoms compatible with COVID-19, and limit the size of and number of social contacts. We can together, by practicing these basics, limit the spread of a new variant or the current Delta variant. The most important thing you can do right now as well, if you haven't already, is step forward and get your COVID-19 shot, your first, second, or third dose if you're eligible. Thank you and merci. Happy to take questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Anthony Fury with Postmedia. Please go ahead.
Hi, Dr. Moore. I'd like to ask you about the tracking of incidental COVID hospitalizations. We know from a Public Health Agency of Canada report that a significant number of kids' hospitalizations are considered incidental, meaning they're in hospital for like a broken arm or something and then just happen to test positive asymptomatically for COVID upon admission, but weren't suffering from COVID. But there's been no report or formal data on the degree to which this is or is not happening in the adult population. Do you know what percentage of adult hospitalizations in Ontario are considered incidental?
I don't at present. We can try to get that data for you, Anthony. It is important to know that if you're getting admitted to hospital, you will be screened for signs or symptoms of COVID, and if you have any clinical indication, testing will be done in many hospitals, especially if they're high risk in the community. All admitted patients get tested for COVID-19 just to ensure that we know their status and that we don't have any spread of the virus in the hospital. But we can try to get you that exact number.
Great. Thank you, Doctor. As a follow-up, I know you've previously said that now you're looking at hospitalizations as sort of a key indicator to guide policymakers in their decisions as opposed to cases. Are you working to getting sort of better incidental data then, if this is sort of COVID hospitalizations, the key metric that you're using right now in your decision making?
Yeah, so as I was saying, I'm very confident in the testing of adults and any patient getting admitted to a hospital. There are standards that are being held, as well as infection prevention and control. I'm certainly confident in the data that comes from our intensive care units. Clearly, that is one of the most important indicators. We get that aggregated at a daily basis and broken down by severity of illness. If there are incidental cases, they would be admitted into the general area of the hospital unless they deteriorate, but we would capture it on the ICU numbers. So our focus on the impact on the intensive care unit numbers remains steadfast. Today, I think we're at 155 with 3 patients from Saskatchewan. So that number has been remaining relatively stable in the 140 to 160 range for us, and we're monitoring that very closely to have both local public health measures put in place regionally and or provincial if necessary.
Next question.
Your next question comes from Adrian Gabriel with City News. Please go ahead.
Good afternoon, Dr. Moore. This week on City News, we've been documenting how people have been using the templates of the old vaccine certificates, the ones without the QR codes, and how they've been creating counterfeit and fake certificates, whether it's Photoshop. Yesterday I spoke with a young adult who shows me how teens and young millennials are using Snapchat to erase the name, erase the date, and put in a name and date that matches the ID that they have in their pocket. You previously said if you hear of more cases of forgery when it comes to the vaccine certificate program, you would recommend to the government to phase out the old pre-QR code certificates. Have you had that conversation yet with the Premier and with the government? If you have, what has the response been? And if you haven't, why not?
So thank you, Adrian. This is an issue that clearly is disconcerting to me. It's important that anyone that's creating fraud realize that there are penalties associated with this. There's the penalty for financial fines up to $100,000, as well as 1 year in jail. So this is not being treated lightly by this government. We've also done investigations of workplaces and, for example, restaurants with multiple different teams that would include Alcohol Gaming Commission, the Ministry of Labor, as well as municipal bylaw officers to ensure that the validation process is being put in play in businesses. I'm happy to report that 98% have been using the verification processes appropriately from our feedback from those task forces that have been trying to investigate and ensure that the verification process is in play. We are advising the government on this issue by collecting this type of data. Very happy with the implementation of the QR code reading and the verification process in general. If we do hear more, we have advised government if we hear of more fraudulent activity that we'd have to move from the progressive enforcement to the fines to show that this is being implemented to best protect our communities, to best protect and limit the spread of this virus and keep our businesses open. And we would advise moving to the QR code if we have as the main means of reading, as this will have the most likely decrease in risk for forfeiture of that signal. So we have advised government, we're monitoring it closely, and it is an important component of our adherence to best practices.
Follow-up?
Thanks for that, Dr. Moore. A question for my colleague Cynthia Mulligan with the announcement around boosters today. The CDC is recommending all adults over 18 get a third dose. Why aren't you recommending that?
So we are monitoring, as you know, we've had a great rollout of the 5 to 11 year age group. And to me, 12.3% today is a fantastic number. And I want to thank all parents and children that have come forward. We have a specific capacity to immunize in Ontario. We absolutely want those that are currently eligible to continue to come forward. So those that are over 70, and today we have over 20% have come forward and got their third dose boosters. And also First Nations, Inuit, Métis members of our community, those that are immune suppressed or transplant patients, and healthcare workers. We built capacity to ensure over the next 2 weeks that those individuals could come forward together with the 5 to 11-year-olds and be able to get their third doses. And this is a call to arms for those age groups. I really want the over 70s in particular to come forward, as we know they're most at risk for waning immunity, fading immunity, and a risk for transmission. In these next 10 days, if you get your booster, you'll be well protected for the holiday season, and children will get the maximum benefit being immunized in the next 10 days for the holiday season as well by getting their first doses. So to me, these next 10 days, we built capacity to ensure that those populations have opportunity to get immunized. We then built capacity for the next most vulnerable group, the over 60 and over 50s, on the 13th. We'll monitor the volume of individuals that come forward for their third doses, and the overall capacity of the system, which is over 100,000 right now. And yesterday we had 67,000 people immunized, so a real call to arms. If we don't see the capacity being used that we've built to best protect those staged and phased high priority groups, we will then potentially open it up sooner to other age groups, but we'll always be in consultation with our Ontario Immunization Advisory Committee. We'll always follow the best science and guidance, and I do believe we'll be hearing from our federal partners on their recommendations on boosters in the coming days as well, which will only further guide further boosters. I also want to assure Ontarians that we're monitoring the immune benefit at a population level from these vaccines, and at 8 months out. For the general population, so 50 and less, we are seeing ongoing good immunity, but we want to be able to provide the third doses in a timely fashion before the immunity fades, especially as we're seeing an increase in cases related to Delta and the potential threat of Omicron to our communities as well. So I hope you're seeing that it is evidence-based, it's staged and phased based on our capacity to immunize in Ontario, but we absolutely will be following the science and opening up third doses if the capacity isn't being used, and following best science.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Thanks, Dr. Moore. I just wanted to follow up on that. You're talking about capacity. So what exactly are you concerned about, that there's not enough people that would be available to administer a vaccine? Are you talking about the system being somehow overwhelmed if you open it up to 18 plus? And is there also a supply issue that you're talking about here, that we don't have the supply to open it up to all adults at this time?
Yeah, well, it is complex, and as you know, we have over 7 million influenza doses that we've ordered for Ontarians. Our pharmacy partners, primary care partners, and mass clinics are providing both influenza immunization and COVID immunization, and we don't want to overwhelm a finite system, and our hospital partners are administering, and pharmacy partners. So we've built capacity to provide the influenza vaccine. We do anticipate the number of doses being provided to influenza slowing down in the coming weeks, which will increase capacity again for further COVID vaccination. All of this is being timed to best protect our communities and follow best evidence. We have ample supply of vaccine. We have actually ample supply of influenza vaccine too, so I'm calling on individuals to get influenza immunized as well. There are some limitations on the throughput because of that immunization for influenza as well as COVID, as well as prioritizing 5 to 11s and the 5 main groups that I've already discussed: First Nations, Inuit, Métis, over 70, immune suppressed, transplant patients, those that received AZ, 2 doses and 1 dose J&J product, and of course our healthcare workers. So we are opening it up. I think there's be over 5.3 million people eligible with the announcement today who 6 months after their last dose can get their third dose. We don't want people booking months ahead. We would like to be able to make just-in-time delivery of the vaccines following capacity and ensure we offer timely access when we have capacity, and not having to rebook when we've built or find extra capacity in the system. So I hope you'll bear with us. It'll be staged and phased, monitoring our throughput, maximizing benefit to Ontarians, and following science.
Follow-up?
Okay, thanks for that. And just in regards to how boosters relate to the Omicron variant, Are they related? Is it your view that this could boost immunity, or is it just still unclear how it relates to that? And just can you talk about the initial cases that have been confirmed? Are these people exhibiting mild or severe symptoms? Did they even know they were sick? Can you also kind of just give some context as to what we're dealing with here? Thanks.
I'm sorry, I can give an update on the Omicron cases, but before that you had mentioned...
I just wondered if you think boosters will help fight the variant, or is it still unclear whether they would have an effect or not?
It is absolutely unclear. We don't expect 100% loss in the efficacy of the vaccine against Omicron. There are over 30 mutations to the spike protein. The spike protein being the main antigen that's being used to develop immunity in all vaccine products. And so all of us are paying very close attention to how much those 30 or so mutations in the spike protein will affect the effectiveness of the vaccine. That science is not out yet, but we certainly think there'll be some evidence of protection. And so giving maximum benefit to our current existing vaccines through third dose strategies will, I hope, continue to protect Ontarians against the risk of Omicron, and best protects us for its eventual entry into our communities. Our main enemy right now, we know, is Delta. It's 99.9% of the strains that we're identifying in Ontario, and we know this vaccine has significant benefit in protecting against hospitalization in the mid-90s, still 6 months later. And so really want all Ontarians to consider getting a first, a second, or third dose of the vaccine to maximally protect us as we go through a social period where I know we're going to have more contacts and hence risk, and a long winter where we're indoors, closed spaces, close spaces, and sometimes crowded spaces. So our strategy really is to maximally protect all Ontarians with first, second, and third doses, given that Delta is our enemy. I do hope and wish that it gives us also protection against Omicron, but I have to be completely honest that we don't have the science to make that statement yet. But I expect some level of protection, given that it's only 30 mutations out of a very long protein that I think will have some antibody protection against it. In terms of Omicron, it's a rapidly changing environment day to day in Ontario. So you're aware of the 4 cases in Ottawa. Many of those had separate flights and separate journeys to come back to Canada. Some were immunized, some weren't. We now, I believe, just had a case identified in Durham, but I promise you there'll be ongoing cases identified throughout today and in the coming days, because we have a very good laboratory system in Ontario. We've got great surveillance. We've got good case and contact management across the health units that are currently investigating cases. And we've got a strong partnership with our federal government, who have set up the testing and the quarantine. We know we had... with the 7 countries, we had over 1,000 individuals identified in the country and over 400 in Ontario that are closely being followed up. So a number of them will turn positive. We just added 3 more countries, and that added over 1,800 individuals that are under surveillance across Canada, a significant proportion of whom are in Ontario. All of them are getting investigated with one test at day 1 and another test at day 8. So just with those numbers alone, we'll know a certain proportion of them will be carrying the virus. So our numbers will continue to rise. I just want to assure Ontarians, your public health units at a local level are following these clients closely. There's good handoff when a positive case is identified through federal quarantine through to the local public health agency, where the local investigation will be done in a very rapid turnaround time. Our turnaround times for investigation are all within 24 hours of notification. Our whole genome sequencing team through Public Health Ontario and our Genomics Network in Ontario is also working full out to try to get the confirmatory testing in place for any positives in Ontario, and we've set up a screening test that's common. The S gene dropout is very common with this strain and unique to it to differentiate it from Delta. So all of that's been put in place. Some of these individuals would have worked in a congregate setting or may have gone to a school. So the complexity of the investigations will be ongoing in the next few days. Our goal, though, in Ontario is just to dampen the spread of Omicron down over the coming weeks, so that we can get the science from South Africa and other international agencies like the WHO to understand this virus more fully. We've had regular contact with the government and science community in South Africa who have been very transparent with us, very helpful to our planning. And so I hope you'll understand it's a very dynamic situation, but we will see more cases. We potentially could see outbreaks, but we're on it, and we've built the lab capacity to respond to this, and certainly have public health capacity to manage the outbreaks.
Next question.
Your next question comes from Natasha MacDonald with Radio Canada. Please go ahead.
Hi, Dr. Moore. Why is the J&J vaccine only being released now? Like, if we have it, why haven't we been offering it, and why is it so restricted to certain specific groups?
So great question. We brought it back from our federal partners because it was requested. There were some individuals that didn't want mRNA, some that didn't want AstraZeneca. We were hoping to have Novavax available to those that didn't want those other products, but we heard loud and clear from multiple partners that some individuals may want the J&J, and we learned from our partners in BC and Alberta who had been providing it at a limited amount. We wanted to make sure people understood if they took it, they'd have to take that vaccine with informed consent. We do think it's inferior to the mRNA. There is still the risk of a clotting disorder associated with it, but it is a tool that could be used in Ontario with those caveats of informed consent. And for those that are somewhat needle phobic, it's a one dose. And so we brought it back because we heard of demand through our local public health agencies, but we needed to understand and be able to explain the potential risks to individuals, and that took us a little bit of time.
Follow up.
On children's vaccination, one of the public health units told us that there's an Ontario-wide target of 33% of all children aged 5 to 11 vaccinated by year's end. But the province is telling us there isn't a target, so I'm wondering if you could clear that up for us, please.
Oh, my hope and my wish is that families are best protected through maximizing immunization in the coming weeks of children. I would certainly be disappointed if we didn't have over 50% of 5 to 11-year-olds immunized before the new year. That would be an aspirational goal of mine. I don't know how much further we'll get beyond that. We've heard through some polling of parents that we may get up to 70% of parents eventually agreeing to have their child immunized and protected with the vaccine. But aspirationally, if you asked me personally, my goal would be 50% by the new year. We're certainly tracking towards that, and we'll be open to the Hospital for Sick Children's helpline for parents. Our websites, our local health units are all willing to spend time to answer any questions that parents may have regarding the vaccine to ensure they feel comfortable and confident in protecting their children with vaccination.
Last question.
Your last question comes from Matthew Bingley with Global News. Please go ahead.
Hi, Doctor. I know you said that the jury's still out on how efficient the vaccines will be when it comes to Omicron, but if you find that it does, or if the findings are that there is significant benefit, how quickly do you see the expansion of other age groups to that booster?
Also, great question. We've been looking at how quickly Omicron has replaced Delta in South Africa and other countries. And we have probably, if you recall, when Delta overtook Alpha in Ontario, it took 4 months for that to occur. We may have a shorter window for Omicron, given that we're concerned that it's more transmissible. So even if we offer third doses in the next 2 months and boost those that haven't had an opportunity for their third dose in the next 2 months, I think that will adequately protect Ontarians if the vaccine remains effective against Omicron. So we have a window of opportunity. That's why I'm asking for everyone to come forward when their eligibility is made available 6 months after their last dose, or 168 days. Please, go online, check. 168 days is the actual metric that's used for the booking system. If you're eligible, please come forward, because we will have a narrow window to provide third doses. We'd love to be able to offer it at a population level in the new year. We're just following the science, following the booking capacity of the system. But I think this is quite a positive move to open 50 and above on December 13th, and hope those that are eligible will come forward and be best protected, certainly for the holiday season, but also for the long winter.
Follow up, and this is the last question.
And on the antiviral trials that are happening in Toronto and Hamilton hospitals, I don't think we've heard that much about them. How many patients have been treated with this with the antiviral oral medication? And I'm just wondering if you could tell us just what kind of result that you're seeing with, I guess, the majority of them.
I'm sorry, I'm not privy to any randomized controlled trials. I don't believe Health Canada has approved the Merck or the Pfizer products. So if there's a randomized controlled trial, I wouldn't be aware of the results if they're being performed in Ontario, nor would I naturally be informed. I can tell you that monoclonal antibody treatments have been put in play for those that are unvaccinated and within 9 days of beginning of symptom onset, if they meet certain clinical criteria. That program's ongoing, and we're trying to expand it, if that's what you're asking about. But if it's about the monoclonal antibody program, I can certainly try to get you those numbers.
Okay, thanks everyone.